We're going into part 2. Is that 4? Hi, I'm Dr. Gary Motykie, and I am a board-certified Beverly Hills plastic surgeon. So now we're going into part 2 of talking about facelifts. I've talked about some good ones. Now I want to talk a little bit, I don't know if I'm going to call them bad ones, but ones I think what happened with some of these people is that older techniques were done. Back in the day, that's all we had. We didn't know the techniques that we have nowadays as far as what's really happening with facial aging. How do we really do these surgeries to make people look like themselves but better, rather than looking strange or overfilled and overpulled. And two that come to mind are Goldie Hawn and Melanie Griffith. I don't necessarily want to say they have bad results, but that they have the typical signs of older techniques and things that were done 20 years ago that are difficult to undo, so they're constantly chasing it and trying to fix it. I think aesthetically speaking, for both of these patients, we're seeing some changes that most patients don't want out of a facelift. They don't want it to be detectable. They don't want their faces to look fuller and fatter and wider or have strange animation and strange expressions. All of those things are avoidable, and that I don't want these type of results to scare people, and I'm not bashing these patients. I do think there are some things that these patients could do to reverse some of these things, but in general, when we're looking at them, we're looking at faces that went from thinner and longer to wider, fuller, overplumped, the skin in the neck pulled in strange positions, the ears changing, even their lips changing, or whether it's caused from the multiple facelifts, their smiles not being exactly the same. All of these things are functions of multiple facelifts or multiple surgeries. These things aren't going to happen to you in one simple facelift surgery. They're things that have added up over the years. Now, along with the rest of the face changing, it can, again, make them look not necessarily younger, but just different. Not that they become unrecognizable, but they don't necessarily look like their younger selves, which is why I consider it more of a not great result. If you take a moment just to look specifically at Goldie Hawn, looking at her now from when she was younger, her face got wider, it got fuller. You can see some signs of facelifting being done, whether that was technique-based or just an older technique. She has bunching of the skin under the neck. You can see some banding that wasn't quite properly got together. The side of her face, you can see some lines when she turns, and these things are all signs that a facelift was done. And I think the plumpness of her face, she's really got it over plumped in areas. So when patients are doing fillers and fat grafting, you got to realize it's not just plump things up and turn into a Cabbage Patch Kid. You want to put that fat in the right areas, create a heart-shaped face, more volume up top, less volume on the bottom. And I think aesthetically we're getting better at that as far as the surgeons and the patients trying to recognize that. So I think some of it may be that it was an older technique. But at this point, if she wanted to reverse it, I think she still has that possibility. I don't think it's so extreme that these results aren't reversible if she wanted to fix it. The last thing I noticed in some of these celebrities that have had multiple surgeries is a change in their smile. And some people pick up on this, and some of it can be due to the multiple vectors and lifting and pulling, whether they pull here, that's going to give more of that pulled Joker look, or whether it pulls the corner up of the mouth too high, and you can see that the extra pulling of the smile. And then lastly, there's a very important nerve that's running along the bottom of the face here, and if it's dinged or hit by the surgeon, or there's bruising or damage to that nerve, it causes this lip to rise up and not come down. And we do see that in some of Goldie's smiling pictures. And those, again, are some of the things that aren't necessarily reversible. Some of them may get better with time, but when I see those sorts of things, they're giveaways to me that facelifts were done. Like Goldie Hawn, Melanie Griffith, I don't think they went to the same surgeons, but similar sort of results. In other words, maybe the technique or how it was done. But we can see, again, starting out very natural, very pretty, and then kind of delving into this world where she looks overpulled. The lines in the face look different or out of place. I think that the cheeks and mid-face overfilled. So I think all of these things give away the secret of something's going on. Particularly in her, I think the lips are one of the big giveaways. I think the nose is naturally aging with her. I don't necessarily think that she did a rhinoplasty per se, but I do see some changes that are indicative that she may have done some tweaks of the nose as well. One thing I do notice in these patients are, again, with the earlier techniques, it's really hard to reverse them if they go kind of sideways. So I see those lines in her neck, I see the pulling, I see the telltale signs near the ears, different things that you can tell, most likely facelift surgery. And then again, interesting, like Goldie, I see a change in her smile. I see almost the exact same side, that the lips riding up, different things, again, maybe signs that multiple surgeries have been done there. And the last thing I think in regards to some of these patients are they seem to really be concerned with lifting and pulling the skin tight or the neck and maybe overfilling. But the second thing you want to really address is the skin itself. And I think a lot of these things could be addressed with skin treatments as far as lasers or microneedling or things to help the canvas or the skin itself with the fine lines and wrinkles. Because when it's all pulled tight, but the skin still has damage and wrinkles and fine lines, again, things are out of balance. If you're thinking about doing the surgery, remember, look at all the different layers of the face. So you want to look at the skin, the muscle, and the fat all together and really kind of balance those out so that in the end, the secret isn't given away.